Another type of confusion when thinking about probability is apophenia, seeing a meaningful pattern in randomness. Although you might not have heard about apophenia before, this tendency may well be familiar. For example, when we look at the stars randomly distributed in the sky and connect them into constellations of people or animals. Take a look at these images of dots, which come from Steven Pinker's book, The Better Angels of Our Nature. One set of dots is randomly generated by a computer program. The other is a pattern from nature. Which one do you think is which? Well, the left image is the computer-generated set of dots, while the right image shows the position of glowworms on the ceiling of a cave. But to many people, the image on the right looks more random, while the left image seems to have clusters and curved patterns. In fact, human brains have a propensity to look for patterns in the information they receive. In most situations, the ability to pick up patterns is a useful skill, but it can lead us astray when we see apparent patterns in what are just random events. One example is of cancer clusters. Sometimes, residents in a community become concerned about what they perceived to be unusually high rates of cancer among people they know, especially if it's a less common cancer. And they call for studies to be conducted to find out whether there's a pollutant in the local environment that could be causing these cancers. In the US, 1,000 suspected disease clusters of this kind are reported to the Department of Health each year. In the majority of these cases, more than 85%, in fact, the explanation for the clusters is found to be chance. In other words, random variation around the average, or a common risk factor within the population, such as age. However, individuals and communities sometimes find it difficult to accept results of this kind, even when they are based on a thorough and wide-ranging study, and they continue to insist that a single clear cause has been missed, in part because of this phenomenon of apophenia. Another important point when it comes to probabilities is that we need to have a clear understanding of the reference group. Here's an example that we might hear if we check the weather forecast tonight. There's a 70% chance of rain in Singapore tomorrow. That's a pretty common way for weather forecasters to talk about the weather. But what does it actually mean? Some people take this to mean that it will rain for 70% of the day. Others understand it to mean that it will rain over 70% of the city, or that 7 out of 10 forecasters think that it's going to rain tomorrow. But what it actually means is that it rains on 70% of the days which are like tomorrow meteorologically. But of course, weather forecasters don't necessarily specify the reference set that they are using, and people are left to interpret what the forecast really means. In some respects, it would be easier to understand and prepare for if the forecast simply said, "There's a high chance of rain in Singapore tomorrow," or "It's likely to rain tomorrow." We'll then make sure to bring an umbrella with us so we don't get caught in the rain. In this case, the extra precision of the 70% numerical value doesn't add much to our understanding of the risk. When we get information about risk then, we need to ask ourselves, who or what is the reference group?
It's quite common to see headlines like these relating to a health or safety risk or a medical treatment. But claims of this kind need to be interpreted carefully. Most of the time, they refer to a change in relative risk rather than absolute risk. Let's clarify that distinction between these two types of risk. An absolute risk is the risk of an event occurring over a time period within a population, say the risk of getting a disease. A relative risk compares risk between groups within the population, such as between people of different ages, or people with different behaviors, or between two time periods. Let's relook at the inverted pyramid of risks. We can see that shark attacks come almost at the bottom. The number of people who experience an attack is very low. On average, there were 80 attacks and 5 fatalities per year worldwide over the last 5 years. While an increase in the risk of attacks over time could be a cause for concern and for further study, the absolute risk of an attack in the population remains very small. We can use a numerical example to help clarify this point. Say there's a rare disease that affects 4 out of every 500 people. An effective treatment that delivers a 50% relative risk reduction would reduce the incidence of the disease to 2 in 500 people. But if we present the same data in terms of the proportion of the population affected, we can see that the beneficiaries of the treatment constitute a tiny proportion of the total. Of course, if the treatment is for a serious disease, then it would still be of great value to those affected. But let's compare that with a treatment for a more common disease that affects, say, 200 out of every 500 people, like heart disease, for example. A treatment that's 50% effective would reduce the number of cases by 100. And even a treatment which is only 10% effective would prevent 20 cases. The impact on absolute risk to the population is larger than the more effective treatment for the rarer disease. Paying close attention to absolute and relative risks, then, is important at the individual and at the policy level when weighing up whether or not to undertake a treatment or take a protective action. Another type of risk that can be difficult to grasp intuitively relates to low-probability, high-impact events. IPUR's director, Professor Ghee, will discuss these risks and how to prepare for them next.